Hi everyone, welcome to the fourth and final segment on self-care. Today I'm going to talk about self-compassion and professional help, and then I'm just going to sum everything up a little bit. So let's start with self-compassion. This is a difficult one. We, human beings, on the most part, are our biggest critics. We are so hard on ourselves. The negative self-talk, the way we speak to ourselves sometimes, if anybody spoke to someone we love that way, we wouldn't stand for it. And yet we speak to ourselves like that. Practicing self-compassion involves treating ourselves with kindness and understanding during times of difficulty and times of failure. Instead of being overly critical, we need to acknowledge the effort that we put into it, and we need to give ourselves credit for the achievements. Instead of saying, I can't do what I used to do anymore because of age. Instead of saying, before my injury, I could do this. How far have you come since your injury? Because it's a new normal. What can you do at your age? What progress has been made? Instead of focusing on all the stuff that we can't do and we should be able to do. As soon as you use should, by the way, that indicates judgment. Quit judging yourself. We need to cut ourselves some slack, for sure. Self-compassion fosters resilience and increases strategies and coping with life's challenges. Okay, moving on to professional help. Seeking professional help is a vital aspect of self-care. If you are experiencing mental health issues, mental illness, relationship issues, don't hesitate to reach out to a mental health professional. And I am not saying that because I am one. Although being one, I can see the value in it, but I've also seen a therapist myself. They do recommend that therapists see therapists. So there you go. Therapists can provide valuable insights, coping strategies, and all of this is tailored to your needs. There's many different approaches. Most therapists base all approaches on a client-centered platform approach, meaning that we see you as the expert of your life. We have expertise, but we're not going to tell you what to do. We're going to help you work through things. Sometimes all you need is to share your thoughts, feelings, and perspectives without judgment and with someone who's not emotionally invested. There's a reason why therapists don't see family and friends. When we're not emotionally invested, we have a helicopter view. We can guide you and help you and just throw out things from a rational perspective that we may not be able to do if we were emotionally invested. Okay. I want you to remember one thing. Well, I want you to remember all of it, but I want you to remember one thing. Recognizing that you need help, reaching out to get help and support is not a sign of weakness. It is actually a sign of strength. So take that step if you need it. Okay, summing it up, incorporating effective self-care practices into your daily routine is an essential part of establishing and maintaining good mental health. Whether it is physical activity, healthy eating, social connections, hobbies and interests, boundaries and limits, big one, remember, self-compassion, getting help, any of the ones I've talked about. It provides a holistic approach to your mental health, your mental well-being, and your physical well-being. I haven't spoken about all of the, getting your hair done, getting your nails done, facials, massages, those sorts of things, because those are common ones that people associate with self-care. I wanted to dig a little deeper. I'm going to challenge you now. I challenge you to prioritize your mental health by making self-care practices a non-negotiable part of your daily life. Okay? All right. Your mind and your body are going to thank you for this. Thanks for hanging out with me for all of the self-care strategies. And I will be back soon with boundaries and limits, because I think I've proven to you through all of this how much value I see in setting boundaries and knowing your limits as self-care strategies. So we will dive deep into that deeper, and I will see you soon. All right, take care of you.